Mycobacterium tuberculosis is the causative agent of the disease tuberculosis, which is a disease that has been known to be affecting 2 billion people worldwide. Although it can be severely deadly, it would depend on which stage the disease is in. So we have a latent stage, which is an asymptomatic stage and cannot spread. And after that, we have a chronic stage, which is active in the body and can spread through the body and amongst other people. Antibiotics typically will work on a disease when the disease is multiplying. So if the disease is in the death phase, the antibiotic wouldn't have much of a significant impact because the disease or the microbes are actively dying. They're already going on their way out. Now, if we have a exponential phase, this would be a great time to introduce a antibiotic. So the key to introducing treatment is very much the timing and kind of knowing what stage this antibiotic is in. So because the bacterium is in the exponential phase, actively multiplying, this is going to be the best time of attack towards the bacteria and slow the infection. For these reasons, it would be more difficult to treat a latent tuberculosis infection since it can remain this way for months. Now, on a side note, tuberculosis is very slow growing, and so we have to think about the usage of this antibiotic. The regimen usually should be taken anywhere between 6 to 9 months to accomplish the required dosage. Now, this is difficult to accomplish as it would be difficult to gain compliance for the patient or the individual, since this is a long time for asking somebody to stick to anything. I mean, we always hear those stories about how in order to kick like bad habits, it takes within a month. Now we're looking at 6 to 9 months. That's a long time. And if we're not consistent with the dosage of these antibiotics, we could be causing more harm than good. This I will actually hit on the next point in a second. So might as well go into that. So number 2. The question I find somewhat relevant to what is going on today with coronavirus. So we're looking at a specific case in 2007, and then we're asking about the legality or the the ethics of having somebody confined. So the reason why I bring this up is because right now we have people not even able to follow mask mandates, and I get it, sometimes they're not super confident in the dosage or whatnot, or it just really depends on the person. There's always these crazy excuses, sometimes with reason, sometimes just excuses. So to have somebody follow something like this regimen, which is about 6 to 9 months to treat a tuberculosis disease, would be a lot to ask for, of course. So XDR tuberculosis is already heavily reliant to drug interactions, heavily resistant, I should say, and namely resistant to isoniazid and rifampin, and also second-line drugs. In general, if an antibiotic regimen is halfway taken, then the most sensitive microbes will be killed off. Person feels better. Feels great. They don't feel like they're sick anymore. However, this leads to the most durable ones being left behind, still active and alive. This simply makes way for the stronger bacterium to thrive. Most likely horizontal and vertical gene transfer could be going on, and we would see evidence in that because there would be mutations. So there'd be more resistance to that initial medicine regimen that was introduced. And especially since it did not kill it off, it has that information now so that it can strive for the next generation. So now that we have this disease, we would see more resistance towards drug dosages, and now we have to get more extreme measures of different drugs in order to even attempt to cure this disease. So if someone is knowingly making a superbug of a disease which is more resistant to medication, it would be putting people at risk. I would say it is okay to confine this individual, since it is jeopardizing so many people, just as it is legal to take someone to jail whom is drunk and actively endangering others around them, especially if they know this is an issue and it will inevitably have people endangered. This is something that I feel is legal to confine until treatment is accomplished. It's for the safety of the person and the safety of the people around them. So I feel like that would be okay. For these reasons, that's why I would agree that it's okay for number 2. Alrighty, thank you so much.